Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning, bright, beautiful. We can see the sunrise coming up.
The sun is rising.
And you brought this very happy man with you. What is he doing here?
DrZaki is a good friend of mine. He's one of the dentists that work with us at the AGI Center. And we had been together now for about 3 years. Yes, working together.
So, Dr. Mencia, we have talked about a lot of things over the many years that you've had this show here on Saturday mornings. And you're a rare, pardon the expression, you're a rare bird. Because I don't know of another medical practice that has a dental practice within it. Why do you think this is so important?
Well, things come to you out of the mishap you see that happened before your eyes. And I remember when I started my practice almost 20 years ago, I had an elderly patient that I sent to a dentist. And at that time, I used to have a small space, 1,300 square footage. I only have 3 exam rooms. So I sent my patient to this dentist, and the dentist call me up and say, please, this lady that you sent to me, she's an elderly lady in a wheelchair. And my practice is, if you have more sophisticated patient, high-end patient, that's the type of practice I have. So please don't send me the elderly. And I say, oh, it will be my pleasure. Okay, no problem. So then, that's the problem. And I usually tell my staff, my manager, when you see a problem, before you bring it up in front of somebody else, think of a few solutions to that problem. Otherwise, you're just passing gossiping, right? So I started thinking, how do I solve this problem? So I say, you know what? I have only 3 exam rooms, so I'm going to close one of my exam rooms, and I open one operatory, one dental chair, and I ended up just with 2 medical chairs. And the patient was so happy to know that under that one roof, they could see the medical doctor and the dentist. But my dream was to have a geriatric center. So I say, wait a minute. As I grow my geriatric center in the medical side, then I can grow the dental service also. So we can have different subspecialists coming in and all of us working together. And it had been so wonderful, Anita. I have seen the dentist calling me up and say, could you please check this patient? And they look too pale and they might be on a blood thinner. And the coumadin level is so high that I usually tell them, okay, don't touch the patient. Leave them alone. Let's treat the coumadin level. Then you see the patient again. So thank God, up to this point, we don't have any complication because we work together. If the patient need to go under anesthesia for any reason, Dr. Zaki and I, who is our guest today, we did one patient, and that we did a patient on a Friday, right? On a Friday.
It was an all-day thing.
Yeah, and it was an all-day thing, and it was very interesting. We got all the teeth extracted. He put the implants on that patient. So the patient ended with permanent denture after all the extraction. So the anesthesiologist left, Dr. Zaki and the dental staff and the medical staff, we stayed there until we managed to get the patient home. So that's the kind of thing that a dentist by themselves and the dental staff don't feel very, very comfortable, doing that kind of work. But I think working together, not only we both feel comfortable, but the patient outcome is much better.
Wow, that was a very good explanation. Dr. Zaki, when you went to dental school, when you went to great dental school in SUNY in Buffalo, which is very, very outstanding school, and worked at the Peninsula Hospital in New York. And I know that you do teach at the Lacombe School of Dental Medicine, but this is unusual, isn't it, for you to be so closely associated with a medical doctor?
Well, I had the pleasure of meeting Dr. Mencia and his physicians and staff about 3 years ago. And let me tell you, it has been a fabulous experience. Not only as professional as it could get, but the family feel that the entire facility brings to the patients. And we see patients from all ages, geriatrics, middle-aged, and younger, and even children. But as Dr. Andy Mencia had mentioned, we do not just do treatment. We do not render treatment. We render care. So we take the patient from what they need and we cross them over to the end result, meaning that we take care of them, we render the care, we render the treatment, and we're still worried about them after they leave the office. We want to make sure that they're 100% comfortable, that there's no discomfort, that there are no problems, that the patient can get from point A to point Z with no obstacles and no issues. And I don't find this. I wish every place in the world could have that feel, because it's been great.
And I'm thinking about Saturday. I mean, here you are, a busy dentist, and you're here early morning at our show at 7 o'clock to talk about it. And now you and Dr. Mencia are going to rush off to the office, and you're going to be a dentist on a Saturday. What, are you crazy?
Yes, we will. It's very tough. Working class and even people that are retired, sometimes they're so busy during the week, and there is no time to get attention to their teeth and their mouth. And evening hours sometimes are very hard to find, and weekend hours are even tougher, because it's just the nature of the population. Some people like to, they have obligations during the week, and on the weekend, sometimes Saturday works for them, and we'd love to, open up that window for them so they can get the treatment and the care that they need.
Yeah, and sometimes you have the the patient family member might work, and they might want to come with their loved one. So Saturday become very convenient.
Well,
for
I
the
have
family.
another thing, and I don't know if it's why it's so mysterious, but why is it that starting late Friday, you get sick? You get
That's
sick,
true.
your teeth hurt,
Yes.
something happens. Is it? I don't know what it is, and it's always, well, you have to come in on Monday.
Yes, and it's interesting. I mean, I love working. As you know, I love to work. And last Sunday, one of my dentists called me and he said, I have an emergency. Do you mind coming so we can see the patient? I said, sure, come on. And I was already at the office. Just come in. I was doing my paperwork. I turn on the compressor, get
That's
everything
not typical
ready.
you. That's not typical you.
Everything was there, and that patient came in. Then he get another call from the operator. There's another patient that needed another extraction.
Wow.
So they came back to back, and it took us under 2 hours, but we took care of 2 emergencies. And sometimes we just bring the patient on a Sunday and maybe just put them on antibiotic and then bring them back so that they can, work on the patient and what have you.
And the beautiful thing is Dr. Andy Mencia somehow chose his staff and everybody in the office to have that same mentality. It's not just him.
Well,
so if he asks anybody,
he has a whip in the back. He whips him in.
The master.
everyone is ready to jump in. Everybody's
You're
ready to jump
absolutely
in. Yeah,
right.
at
I
any
see-
point
I see
in
why
time.
he likes you so much. You have this beautiful smile, and it's really true. He does set. They always say it comes from the leader, from
Yes.
the top, and that's what we see. But Dr. Mencia, go back to this other thing. Where they say there's the white coat syndrome, that you go in and your blood pressure is high and all that. What is it on the week? What is it that causes people to seem to get sick on the weekends?
On the weekend, no, people get sick
Am I just
all
imagining
all
that?
the time. Yeah,
Wow.
all the time. What happens is when they do get sick on the weekend, unfortunately, our society is set up in such a way that it's hard to find a provider that will cater to you, to do weekend call. And there is a group in Chicago that they are opening 12 hours a day, 7 days a week. And, it has become very popular.
Do you think this is a trend that
So
you've
it's
started
a trend
here?
so people are picking up and saying there is a need out there. and maybe the staff is less on the weekend, but at least there is staff. And in my practice, we don't have a full staff, but we have enough staff. Sometimes the dermatologist is seeing patient, the podiatrist, the home visiting doctor is there on Saturday seeing patient. So we have the staff, or out of the staff, those people that are willing to work on the weekend, that we bring the supporting staff. So to accommodate. When it's only me and Dr. Zaki, it's just a small group of the dental department and a small group of the medical department to help us take care of the patients.
Okay, and now people have said to me, you do not give the phone number enough, and I'm going to do it again. So we have Dr. Andy Mencias. By the way, if you look at the cover of Boomer Times, this April issue, you will see Take Care of Your Kidneys, and so they can take care of you. That's a wonderful book that Dr. Mencia wrote. We want you to go. You can call, and you can order yours. If you want him to autograph it, you can go there and pick it up, and it's very inexpensive. I think, what is it, $10 or something? It's very cheap.
It's cheap.
It's very cheap, but it's very well done. You'll see we did a book review on it, but his offices, he has 2 offices, and home visit services are available for homebound patients, very important. The office in Fort Lauderdale, the phone number is 954-489-1345, 954-489-1345. It's right on Commercial Boulevard, very close to Holy Cross Hospital. And they have a gorgeous new office in Boynton Beach on Hagen Ranch Road, and that number is 561-270-6494, 270-6494. And remember, this is Pencil Talk Radio. Get your pencils out, write the phone numbers down, put it on your refrigerator. Don't leave home without it. So I have a question for you, Dr. Zaki.
Sure.
I don't know what this is and if you still do this, but my son, when he must have been playing baseball, something happened, and half of his front tooth, he was young, got chipped off. And I thought he'd have to have a whole new tooth. What they did is they put stuff on there, and I think he may have it today. What is it that they did?
Well, there are a number of solutions to any trauma to the teeth. Of course, there are levels of trauma. A straightforward trauma, sometimes that, kids are playing baseball or playing basketball, they catch an elbow to the face or bite into even a fork. Sometimes you're too hungry, you bite into a fork. And given our society now, you can't walk around with a chipped tooth just like we used to do maybe 30 years ago. Now, unfortunately, people are very judgmental of the way you look, and the social media and posting pictures. You can't smile, you can't do this. So there's a quick fix to it, which is just applying a bonding that's tooth colored, that's seamless, that you cannot really notice with the naked eye to compensate for the fractured portion of the tooth. The other option is we can do porcelain crowns, which are metal-free. There's no metal in it, and they mimic what God created in such a wonderful way that it's virtually undetectable. So there are a few options to regular, straightforward trauma. Of course, when the cases demand a little bit more severe treatment, there are more options to that. But a straightforward fracture, we can either apply the bonding, which is composite tooth-colored filling material that mimics the tooth in a very almost undetectable way, and there are porcelain crowns, which are metal-free, and again, they're undetectable with the human eye.
I have seen, Dr. Mencia, I've seen people, though, then, it's interesting you mentioned that, with little chip pieces of their tooth, and I thought, why don't they get something done? Could you, if someone has a little piece of a tooth off, could they come to you, and would you fix that?
There's a solution to everything.
Yes.
There's a solution to everything.
So it doesn't have to be major. We know that they could have major reconstruction.
Of course.
But just for somebody, because I think I just heard a friend of mine fell and cracked her tooth, and I was going to tell her.
We
do it all the time. It's straightforward stuff. There's a solution to everything.
Yeah, the main problem is that when you chip chip a tooth, if it's very superficial, if it's not touching the nerve, it won't bother you. So it's just the look of your smile when you are talking that it will distract people to look at that. And then people become psychologically affected by that. Of course you want to get that fixed, And it makes no difference how long ago it happened. You can always come and see Dr. Zaki, and he will take an X-ray and look at the nerve and then see how much, what's the best way of fixing the problem.
And then it gets colored. It matches your other tooth.
Yes, just like the natural tooth of the natural
So
too.
you're an artist also? Do you
Well,
like?
you have to be. You have to
I
be.
mean, do you do
Yes.
any painting or any
You have to
sculpting
be.
on your own?
Well, I do play piano.
Oh, so
But
did
that
you
different
know
kind of
that?
a different
You
kind of
probably didn't
art.
know piano.
And I can paint if I wanted to, but I have no time. I'm busy between the office teaching and being here.
Well,
But tell us about the importance of replacing missing teeth. Some
again,
people go around and, when you are kids, teeth come out, you just take them out and the other one will come up. What about, as we grow up, what's the importance of replacing? Is just because of the look or is there...
Well, it has a few sides to it. Number one, of course, what people like to consider cosmetics these days. Applying for a job, trying to get married, having a wedding coming up, having a party. You want to look your best. The other thing is the function of your mouth. Of course, when you're missing teeth, you're taken away from that function. And your facial structure, the way the skin lays, the way your cheeks go on your bone, the way your chin looks, all that is affected by missing teeth. So when a tooth goes missing, okay, big deal. No, let me not go fix it. No, your teeth will shift. Your face will start sinking in. You will add years on top of your real age by unnoticing, your missing tooth and just neglecting it. After a while, you'll miss another one, and then you'll get another one extracted. And it's just a chain effect. So one will go, and then the second and the third. If you don't do anything about them, you're just adding to the problem, and it's not ceasing at that point. So it's very important to restore the missing teeth and do something about them. So the face gets the support that it needs, and your smile gets the support that it needs. Your cheek, your lips. So it's very important, not only dental-wise, but facial-wise, cosmetics-wise, skin-wise. And then there's the social aspect and there's the psychological aspect. When you're more accepted, you can smile without hesitation. You can just have such a big
So how
smile.
do you replace? Let's say you have a missing tooth. What does that require?
There are a few options to have missing teeth. Of course, there are the new implants that everybody's talking about. And people think that it's such a tough procedure. No, it's not at all. Implants are pretty much artificial teeth that we plant in somebody's jaw. And they're virtually without any discomfort. Patients go home that same day, they don't feel anything. And the end result is really phenomenal. There are also dental bridges, which are they're porcelain work that we can put in somebody's mouth, supported by his other teeth. And they look also very, very nice. And the result is fabulous. Between implants and crown and bridge work, there shouldn't be anybody walking around with missing teeth and depriving themselves from the joy of having a full set of teeth in their mouth. Yes, I don't want to walk around and see anybody with missing teeth that's affecting their life. But, yeah.
And the thing is, sometimes you miss a tooth on the right side, and you say, the next tooth you're going to miss, you think it's going to be left. It might be right. So what happened is as the
balance shifts.
The balance starts
balance
shifting, and then your jaw starts shrinking on one side more than the other one, and the deformity on your face. That's why you see people that when they have the wrinkle, is more pronounced on one side of the face than the other one. It's the way they sleep and also the structure of their mouth.
You should see what we can do without any Botox or any injections or anything like that. I'm serious. Yeah,
interesting.
you can have
That's
a lot of wrinkles around your face and your smile, and that could all be gone with a full set of teeth. You can deduct about 15, 20 years of your age off the bat.
Now, we did that one patient, Dr. Zaki, that had a lot of teeth that were bad, and we have to extract all of them. And then you did the implant of the permanent denture.
Yes.
What
in a case where we have too many missing teeth, when we cannot just compensate by one or two implants or one or two bridges, let's say the entire dentition in somebody's entire mouth is just totally gone bad, and people are judgmental, but that's just nature of the game. We chew with our teeth, we bite into hard things, and sometimes they go neglected for a little bit of time, but they tend to go. Sometimes we end up going, but the teeth, if the teeth end up going, what we can do is remember the old-time dentures that
Yes.
sometimes people wear them and
Yeah.
they complain all the time that they're moving. Now we can make these teeth sit on some nice implants in somebody's mouth. And I remember, Andy, that patient came in. We had an anesthesiologist in the office. The patient went to sleep. We took out all the rotten teeth. The patient, of course, was he was under general anesthesia, and we got all the teeth out. We put some implants, and these implants had the teeth go on them, and the patient has a full mouth of teeth that do not move, that do not swim when his tongue lifts up, when he's talking, when he's sneezing. And I think that's a huge service to the patient.
I tell you, he is my patient, and after we have done this procedure to him, his sugar is much better controlled. He was losing weight.
Yes, that's the medical
because
aspect.
he couldn't eat food properly, so he wasn't digesting the food properly.
And the amount of infection that was swimming to his bloodstream from these
so
teeth.
his sugar now is so much better controlled. His weight have improved so much, and his quality of life. He's even dating now.
Yes,
the guy that
yes,
was living by
beautiful,
himself. So now he's dating.
good
He's
point.
more confidence now in himself, and he's a young guy.
Yes,
He's a young guy.
yes.
He's not an
I just
elderly
thought
man.
now about on your dating profiles, you should say, and my teeth are good. And if not, go to the AGI Dental Center.
And if you read, people actually they want to date somebody that has a full set of teeth. You want to get married
Yeah.
to somebody that has a full set
When
of
you
teeth.
think about that, I'll bet they don't think, because then they have odors in their mouth too. Let's talk about that. What happens when you have bad teeth? You have bad
you
breath.
have bad breath.
Yes.
Right. Well, and the thing is, when you opt to remove your teeth, or you lose all your teeth, or what have you, and you just put denture on, when you bite on food, you have much less power than the power that your own teeth will produce. So if we throw a number, let's say the power on PSI is like 400,
450.
it's going to drop to about 10. That means when you're trying to bite on a corn or a piece of steak, and you are trying to chew, remember, digestion starts with your mouth. Your digestion don't start in your stomach. It starts with your mouth, and you have to masticate the food. You have to bite on the food to start cutting into tiny, small pieces so that the rest of the GI tract can proceed with the digestion. So if you don't have a full mouth, teeth in your mouth, then your digestion is going to be incomplete.
Unless you want to put your food in a blender every time. You
Exactly,
Just drink it with
if
a
you
straw.
want,
yeah.
That's why God created them. Yeah.
Yeah.
So you're saying that actually it has a lot of other ramifications. I mean,
That's
not
correct.
only for the good looking and for the health, but the digestion. So people who have GERD or have other kinds of things, that could be caused because they're not chewing their food properly.
That is correct.
Because their teeth aren't really, I guess God made it so that all the teeth are supposed to look good, right? Or
Yes.
not look good, but they all work
And
right.
it's
they all work
unfortunate,
together.
And as they-
I get so many patients that because the front part of their mouth, they still have teeth there, but the back, they are edentulous. There's nothing in the back. And they feel it's okay. So I say, how do you think you chew your food? You don't chew your food with your lips. You put it inside your mouth, and inside your mouth, there's nothing there to help you bite on the food.
Yeah, you think about that. That's right. They don't. How are they biting them? They're not. So what's happening to the food?
It's very tough. It's a very tough balance.
difficult.
It's a very tough balance.
difficult.
Oh, so they're the ones that eat mushy things that you said. They don't have steak. They don't have chicken. They don't have stuff
They
that's
can't
hard.
go
can't have
out and
anything.
eat steak. They have to eat at home. Now you see them trying to bite in front of their mouth with their hand, using their hand.
It is very tough. It is.
There's no need to live like that. But tell us about the different type of crowns that we have also, and how do you work with a patient when it comes to building up a crown and choosing the
First,
type
tell
of
us what a
crown?
crown is.
Yes.
Long time ago, when we had a missing structure of a certain tooth, we used to do nothing. Now, well, things have evolved. We used to have metal crowns, the gold crowns. Sometimes you still see them on some on a certain part of the population, and things have evolved. Now we have porcelain crowns, and these porcelain crowns are, think of a hat that goes on top of a broken tooth, and this hat mimics the original structure of the tooth. It's strong. It's pretty much, I tell my patients, it's toilet bowl strong. So this porcelain is very tough, and it looks fabulous. It looks so natural. It reflects light in a certain way that nobody can detect it. And of course, we match it to the patient's desirable shade. And of course, most people would like just the super white shade of teeth. And we have all the power and all the authority and all the control to change the look of these crowns and the look of that smile according to what the patient wants and according, of course, to what we think as dentists that's best for the patient. And these crowns are, again, they're not detrimental to the teeth, and they go on top of your natural tooth. whether it be a crown, whether it be half a crown, is what we call a veneer, or a 3/4 crown. It's just to compensate for missing structure of the tooth. So you don't have to walk around with broken teeth and teeth that are bumped out, or teeth that had decayed, that was excavated and taken out after a while. But yeah, they look fabulous.
You know,
So
Doctor.
let's say like Anita's son, when, if the tooth that he broke, he can go if he wants
Yes,
to.
if sometimes if I elect, or I'll tell the patient, I think the bonding is going to be a great option for you, or I think we better put on this porcelain crown, and the porcelain crown is going to compensate for a bigger portion of the tooth. So if you have a little bit of a chip, or a reasonable broken part of the tooth, we can bond it. If it's a little bit bigger than what we think we can fix with the bonding, then we can put up our
This
the
happened
porcelain
when
crown.
he was, like about 10 or 11, and now he's 50. I have no idea. He doesn't. His teeth are. I don't know if he's ever had new. I don't know anything about it. He's out of my world.
Bring him
I'm
over.
gonna ask him, though.
Bring him over.
And
I'm
then-
asking, and trust me. Where's that? What happened to your tooth? Did you ever have something done?
Maybe
But
he got a
anyway,
crown
I know
for him.
that's right. We're running out of time. But you see, this is now one thing I know is you don't do those things. You don't make it there in your. Once you decide what they need, then you have a laboratory that you're careful when you send it to.
We make most of
yeah,
it. We make
yeah.
most of it. Sometimes because we need an oven for the porcelain to get glazed in. So, but we do most of the work. We take the impressions, and then we have our very skilled laboratory and technicians that help us to get the final outcome.
That's really important
Yes.
because a lot of times it takes a long time to
Yeah,
send
it's
it
a lot
away,
of
and it
communication.
comes
There's a
back,
lot of
it's not
communication
good.
between us and the laboratory
Fantastic.
all the time.
Well, I know why you brought Dr. Zaki here. I know why. I mean, he really is.
He's phenomenal.
Dr.
He's
Zaki
phenomenal.
Yeah, he's pretty, and he's
Handsome,
pretty.
handsome.
I wanted to say pretty. I think he's pretty.
Okay.
Forget it.
Thank you.
And he
I'm glad to
doesn't
be
work on
here.
his own teeth.
Yeah.
I'm glad to be here.
Well, he's good, and we thank you for coming. And
Thank you. Thanks for having me.
Dr.
Thank you for
Mencia,
having me.
You're
It's such a
gonna
pleasure.
have a big day there today.
Yes,
So
we will.
everybody,
Yes,
if
we
you're
will.
having any problems with your teeth, this is your chance. Go meet Dr. Zaki. Go talk to Dr. Mencia. Call 954-489-1345. And Dr. Mencia is going with a big stack of Boomer Times. You can go there and you can pick them up there at their wonderful center. So thank you very much for being here. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.